Hello, welcome to Medicine and Miracles. I'm your host, Dr. Scott McMahon, and here we're going to talk about medicine and we're going to talk about miracles. It's going to be great. So today we're continuing our series on chronic inflammatory response syndrome, and we're talking about different symptoms. So today the symptoms I want to talk about are polyuria and polydipsia. You probably don't know what those are. Maybe you do, but you probably don't. Polyuria really would be better to say urinary frequency. It has to do with the number of times that you urinate during the course of the day or the course of the evening. And then polydipsia is how often you drink. Now, if you have diabetes, you might be familiar with polyuria and polydipsia because they can cause you to drink and pee a lot. But in CIRS, it's completely different. So it's the same kind of symptom, but the cause is completely different. So first, let's get some definitions. When I'm saying polyuria or really urinary frequency, there are different definitions in the literature. What I was taught when I was in residency, what I've seen in the literature is that if you're urinating more than 4 times a day during the daytime, that's too much. But I've seen it say up to even 10 times a day, which I think is crazy. I don't know anyone who's sick that urinates 10 times a day, but maybe it happens. Okay, and again, I spend my day with sick people, so who knows? Nighttime urination is a whole nother story. So assuming that you're toilet trained, if you're less than 45 years of age, the medical literature says you should have less than 1 urination a day, like 0. Like you should not be waking up in the middle of the night to go to the bathroom on a routine basis. It might happen every once in a while, but not on a routine basis. Now, once you hit 45 years old, males and females, then you might start going to the bathroom once a night, but just once a night. Shouldn't be 2, shouldn't be 3, shouldn't be 5 or 6 times a night. Now, you can have daytime urinating that's too frequent, or you can have nighttime that's too frequent, or you can have both, or you can just be normal. Okay? I'd like to think that you're normal, but 85 to 86% of patients that have chronic inflammatory response syndrome will either have nighttime or daytime or both that are in excess of what I was telling you. Okay? Now, on top of that, we have polydipsia, which is drinking too much. Now, there's an actual definition for that. We don't actually monitor how much you're drinking because you usually don't monitor how much you're drinking unless you're trying to get in a gallon a day. And certainly, the more you pee, the more you're going to drink. Right? What we're looking for is people that just feel thirsty a lot or feel dry a lot of the time. They usually will be carrying water with them wherever they go. They've got a bottle, they're swigging all the time, and then they have to go to the bathroom a lot. Now, I mentioned before that the same symptoms can occur in people that have diabetes, but it's for a different reason. People with diabetes have high blood sugar, and that high blood sugar, when it gets to the kidney, draws water out, you make a lot of urine. People that have chronic inflammatory response syndrome, it's different. There's a chemical that's made in your brain called antidiuretic hormone. And when you release that from your pituitary, which is right there with your brain, when you release that, it gets in your blood, it goes to your kidneys, and it says, stop making urine. So you cut back on urine. In fact, that's the reason why you don't pee in the middle of the night. It's because you're making a lot of antidiuretic hormone while you're asleep. That's part of what toilet training was years and years ago, so that you just don't make as much urine. And then when you wake up in the morning, you empty your bladder. But people that have CIRS, about 86% of the time, so that's 5 out of 6 patients, they don't make or secrete enough antidiuretic hormone. When we measure the level in their blood, it's like absent or almost absent. And it's not enough to regulate the kidney to say, don't make the urine, save that water, because the body needs it, because the body's getting dehydrated. So then you just pee. And because the result of that is you get thirsty. And so then you drink and you drink and you drink. But because you don't have any antidiuretic hormone, you just pee. And people will say to me, I pee so much because I drink so much. But the truth is, that's not correct. You drink so much because you pee too much. Isn't that fascinating? So that's polydipsia and polyuria, or urinary frequency and drinking too much in chronic inflammatory response syndrome. If you want to learn more about chronic inflammatory response syndrome, I recommend you go to CIRSX.com. They have hundreds of videos. They have professional published literature from the experts around the world, both in the medical and also in the environmental fields. It's all there. It's all free. There are also some other courses, like if you're an indoor environmental professional, you want to learn a better way to do medically important assessment, or how to go into the home of somebody who's sick and not make them sicker when you're doing your mold testing, or medically important remediation, which is designed to make the home of your client what we call healthcare clean. If you want to do that, go to CIRSX.com. If you want to learn more about this illness, if you want to get certified, if you want to take proficiency partners, if you want to do any of those things, go to CIRSX.com and we will get you on the right pathway. Now, if you're a patient and you're looking for a provider, you want someone who can tell you whether you have CIRS or not, at survivingmold.com, they have an interactive map that lists all the providers and all the diplomats in the United States and gives you contact information so that you can contact their office and get into services. But there's a new way also at moldco.com, moldco.com, where you can get direct to consumer services, and they'll take a medical history survey, and that'll go to a trained provider, and they'll make decisions with you as to whether you have mold toxicity or are likely to, and what treatment plan that you should consider. So that's moldco.com. And finally, we just had our CIRSX annual conference. It was amazing. If you missed it, then check in for next year's, and you'll find the information at CIRSX.com. Okay, now we're going to move to our miracle. This happened in like 1993, 1994. I was a brand new Christian. I had just given my life to Jesus. I'm hanging out. I'm seeing patients in my pediatric practice. And I had met this lady who had actually become friends with my wife. And so when she would come in, we would chat for a few minutes and we go on. Well, this lady was in her 30s, and she already had high blood pressure, she had diabetes, and she already had kidney damage. She had all three of these in her 30s. She's taken medicine for each one, and we didn't have a lot of anti-diabetic medicines at that time, so she had to take insulin, and she was a mess. She had really bad health. Okay. Well, then she met Jesus. She met Jesus. And she asked him, would you heal these things for me? And he did. Okay. Now, I saw her lab work before she became a believer. So she had diabetes. Okay. She had kidney damage. Okay. And she had high blood pressure. And she was taking meds for all of them. And this lady, after she prayed and asked God to heal her, he healed all three of those. And I saw her lab work afterwards. I saw her blood pressures afterwards. She stopped taking all of her medicines. She was completely healed. Now, if you get healed, okay, and there's no reason why you shouldn't be able to get healed, but if you get healed, okay, I don't recommend that you just abruptly stop taking your medicines. I recommend you go see your doctor and let them check your blood pressure and see that it's low and you don't need your high blood pressure medicine. And let them do your hemoglobin A1C and let them see you don't need therapy for diabetes anymore, or check your blood sugars and see that you're doing really well. Okay, check your chronic kidney disease and with blood tests. I don't recommend you just go off your medicines. You need professional advice before you do that. But I'm telling you, this woman, like overnight, went from having all three illnesses, chronic kidney, high blood pressure, and diabetes, to being completely cured of all three of them. And I've known that was 30 plus years ago. The last time I asked her, I haven't talked to her for about 5 years, but the last time I asked her, she was still healed of all three of those. Isn't God good. We give all the glory to God because believe me, doctors, we can't do that, but God can. Okay. Now let's move to our moment of hope. And today's moment of hope comes from the Psalm. And there's a verse that I just love. There's actually a song that I just love. And because I care about you, I'm not going to sing it. But maybe sometime, if I get a lot of comments asking me to sing it, maybe I will. But then it's on you, not on me. Anyway, that verse is Psalms 42:1. And it says, as the deer panteth for the water, so my soul longs after thee. Now that's the King James Version. And basically what it's saying is, you got a deer, he's been running around all day, and he's thirsty, and he's looking for a place to drink, and he finds the place to drink, and he dips his tongue in there, and he starts drinking from that cold, crisp water. It's so refreshing. It's such an awesome feeling. And when you think about that, okay, that's the way my soul wants to spend time with God, because he's so refreshing. It's just... the worries and the difficulties of the day, he can just lift right off of you when you come into his presence. It's so refreshing. I hardly have words for it, as you can tell, but it's something I look forward to constantly, spending that time with him, being refreshed by his Spirit, and getting to know him better and better and better. So that's our show for today. It's medicine and miracles. If you liked what you saw, if you learned something, hit like and subscribe. And join us for our next episode of Medicine and Miracles, where the mysteries of the human body intersect with the unsearchable God. I'm your host, Dr. Scott McMahon. Goodbye.